The U.S. Centers for Disease Control, as of yesterday, reported 251 million people have received at least one dose of the COVID-19 vaccine in the United States. Of those, 210.5 million are fully vaccinated, and more than 84.3 million people have received a COVID-19 booster dose. However, some Americans continue to protest vaccine mandates as the U.S. enacts vaccine initiatives to curb the spread of the coronavirus, as well as providing over 400 million N95 masks free to the public. Our Washington correspondent, Maria Bird, brings us more.
Despite the havoc that the COVID-19 Omicron variant has caused in the U.S., infectious disease experts are anticipating that Omicron will not dominate life in the U.S. in 2022. Within the past week, there has been a reduction in COVID-19 cases in 19 U.S. states, Washington, D.C., and Puerto Rico. This is positive movement after an aggressive winter spike in COVID cases at the onset of the season. The White House Coronavirus Task Force has released data that suggest that the booster vaccination vastly decreases the possibility of one having to be hospitalized or visit the emergency room if they test positive for the Omicron or Delta variant.
In general, we see lower overall vaccine protection against Omicron, as we saw against the Delta variant shown by the blue line, especially with just 2 doses of an mRNA vaccine. For those who received the first 2 doses, vaccine effectiveness was 38% against emergency room visits and urgent care visits after 6 months. However, vaccine effectiveness increased up to 82% for those who received their booster dose. Similar as to seen with emergency department visits on the prior slide, for both the Delta and Omicron variant, there was a decline in vaccine effectiveness against hospitalization over time. But following a 3rd dose, vaccine effectiveness against hospitalization with Omicron increased to 90%, nearly matching the effectiveness against the Delta variant and even higher than vaccine effectiveness after the first 2 doses of the mRNA vaccine.
In addition to the increased efficacy of the vaccine with a 3rd dose, experts believe that the increase in testing is another mitigating factor in combating the virus.
And we're currently processing 100,000 samples per day with less than 24-hour turnaround time.
Let's rethink the whole process and say, how do you do this at really high volume and high scale? And so that sample tube that we collect in the field goes nearly straight from the field into our automation instead of a bunch of handling manipulation by the lab staff. We're able to just take them in from the field and drop it into the automation. There's definitely a place for antigen testing. We think it's a piece of the solution. The downsides with antigen testing is just not nearly as sensitive as what we're able to do here with PCR testing. And what that ultimately means is we're able to pick up infections in people days before they show up on an antigen test.
While the peak of the recent wave of COVID-19 may be ending in the U.S., experts believe that the only way to continue with a decrease in daily cases is through vaccinations, continuing to wear masks, and frequent COVID-19 testing. From Washington, Maria Bird, Channel Television News.
Well, joining us for more on the situation in the U.S. is Dr. Mercy Edionwe, hospitalist, joining us from Texas. Welcome to the program.
Welcome. Thank you, actually.
Thanks. Omicron, we understand, has now peaked in the U.S. And do you agree, especially, what are the numbers saying in your region?
Well, yes, we are definitely seeing a decrease in cases. In Houston, where I'm actually practicing, there has been actually a decrease. It went from 13,000 cases a day down to 9,000. So we have peaked, but it's still high cases. And so we definitely still need to do our preventative measures to combat this COVID-19. We're still seeing high cases coming into the hospital and hospitals full of COVID-19 patients.
We also understand the CDC announced U.S. travelers to avoid some countries. And I mean, the question was, will they listen? Do you think that people care with COVID and the way it's spreading?
Well, that's a very good question. There is COVID fatigue that is rampant around these parts of the country. I mean, you have to understand, COVID first hit the United States January 21st, 2020. That was when we had our first case. And so we've literally been in COVID season for about 2 years. So we have seen increased numbers of travelers, according to the TSA, which is our Transportation Security Administration. We've seen an increase. They compared to last year, like it was about 700,000 per day of travelers. Now it's 1.3 million, but it's still not up to the 2 million that we saw prior to COVID. I just think that people are traveling because they are tired of being at home, but there are preventative measures that they can travel safe now.
How much would you say rapid diagnostic test kits have actually helped reduce the spread of COVID-19 in the US?
Yes, I definitely do. I definitely think it's one of the preventative measures that we are using. If you recall, previous, like last year or even the years before, one of the reasons why there was a spread in cases is because there was no access to COVID rapid testing. Now that the President, Joe Biden, has now mandated that there should be more rapid antigen tests in the country, we're seeing more and more people able to now be able to know their COVID status and either get quick treatment or quarantine themselves. And this will lead to a decrease in the number of transmissions. So yes, I definitely am happy that that is one of our ways that we're reducing the number of COVID transmission rates here in the US.
But do you also think that learning to live with the virus is perhaps a technique that the US CDC is looking at and the Biden administration in any way, perhaps just like countries like the UK is doing?
Come again, can you say that one more time? I'm sorry.
So I'm asking that, do you think learning to live with the virus, which is what the UK is sort of doing with, you know, the markets recorded in vaccination and tests and the boosters, is the US adopting that or still working to try to reduce the virus to the barest minimum and try to get more people vaccinated?
Yes, I think that learning to live with the virus is key and important. And I think we are here in the US trying to do such things. I mean, we haven't had a lockdown as a result of what we've learned from having previous lockdowns. It doesn't necessarily decrease significantly the spread of COVID-19 and the way it affected businesses and economies. We're now learning, okay, what are other ways, what are other preventative measures that we can use to help reduce the COVID-19 spread? You know, as I'm seeing now, the society is just opening up, and, you know, we're modifying what we're doing as a society to circumvent having increased numbers, but, you know, we're learning.
Oh dear, we appear to have lost Dr. Mercy Dionwe, but we'd like to thank her. Thank you. Dr. Mercy Dionwe is a hospitalist, and she's been joining us from Texas, Houston, Texas, in the US.